we had a request from the group, the SHAIR Collaborative, to say, why don't you measure whether or not these tools are having an effect on people's decisions? And we called that shifting people's preferences. So Hannah, over to you.
Yeah, thank you, Glenn. So we implemented the patient preference shift questions starting this past October, so October 23. So we do have 387 survey responses total. Of that, 145 patients have responded to this new set of questions specifically. And like Glenn mentioned, this is part of the anonymous patient survey that patients can either scan a QR code to, or some clinics do have iPads in the clinic where they can fill this survey out after. And what this shows, or I should say the questions ask, is before you meet with your surgeon and review the option grid, what treatment option were you thinking? And then after you meet with your surgeon and review the option grid, what treatment choice are you thinking, or have you made a decision yet? I think the most notable thing to review is that about 51% of people had not decided before meeting with their surgeon and reviewing the option grid, which makes sense. And then after that, a significant portion of them did make a decision, whether that was choosing mastectomy, lumpectomy with radiation, possibly remaining undecided, or moving to that other category. Just for a little bit of background, the other category, whenever someone selects other, they have a little free text response section, so they can provide more details if they want to on what the other might be. Typically, responses we've been seeing include waiting for another surgical consult, perhaps for reconstruction, considering hormone therapies, or there was one more, which I am blanking on. The possibility for more genetic counseling before making a decision. So it's typically waiting on other doctor's appointments. Does anyone have any questions, feedback, or thoughts on this visualization?
I have a question for you. Do you have qualitative data to go along with this?
We do not from the patients.
Okay. That would be kind of interesting to hear why they made the decision they did for themselves.
Yep. So that's a good question. We don't have that. One thing we're working on, we have the data, but we're working on the graphic visualization of it. Is so, for example, for those who hadn't made a decision, we're working on some sort of bar graph, branching logic, tree graph to show of that 51%, how many of them chose mastectomy, lumpectomy with radiation, remained undecided, or other. And it would kind of show you what decisions they moved from, which isn't quite the same thing as the qualitative data behind why they're making those decisions, but might get a little more insight into the process.